Good morning, all of you, and welcome to another episode 10 of The View. 10 episodes. That's a milestone, I think. 10 of the rest of our lives here at Olive View, episode 10. And I'm joined today by Dr. Waterman. Thanks for being here, sir. I know you've been asking to be here. We're finally be able to get you on the schedule. Are you excited?
It's a privilege to get the invitation. Thank you.
All right, Dr. Waterman. So, we'll start with announcements. Mental Health Awareness Month. This month is Mental Health Awareness Month. And Kelly McSwan and Tristan Webster from the Department of Health Services Office of Wellness have provided a special video for Mental Health Awareness Month, showing why caring for your mental health is essential. The video highlights helpful resources available for staff for managing stress, supporting overall well-being. So take a look.
You always say, can't take care of other folks until we take care of ourselves, right? We're not always as good as we could be in the healthcare field. So please take a look at this video.
Hello, Olive View Medical Center. I'm Dr. Kelly McSwan.
And I'm Dr. Tristan Webster.
And we're the wellness psychologists on the workforce wellness team for LA Health Services. The wellness teams that have been established throughout LA County have come to the realization that, just like our motto says, our wellness promotes all wellness. It's both an equity issue for our workforce and good for the community that we all serve. We all deserve a work-life harmony that includes psychological and physical safety at work, among other elements that promote wellness. Also, a well workforce is a more effective workforce, thereby ultimately allowing us to do more good for the people that we serve.
We were invited to speak about Mental Health Awareness Month and its importance. And I think often the importance of things are best illustrated by their history. Mental Health Awareness Month was started by an institution now known as Mental Health America. It was initially founded in partnership with a famous psychologist and psychiatrist by a man by the name of Clifford Beers. Mr. Beers, by his own experience and that of his family, had observed the difficulties of both mental illness and institutional treatment of mental illness, and set out to address mental health. At that time, they called it mental hygiene, and its treatment. It's been nearly 120 years since the establishment of that organization, and over 75 years since May became Mental Health Awareness Month. The idea remains, 1, reducing stigma around mental health issues. We live in a society that's big on expecting us to pull ourselves up by our bootstraps and not asking whether or not you have boots or straps. The truth is, the human experience is much more complex, and real strength is found in being able to be authentic with ourselves and our communities. Encouraging conversations around mental health. The more we can talk about our mental health, the more sustainable it is. And it also helps each of us learn from one another and what we can do to help ourselves and help one another. We all end up better for these conversations. 3, creating resources for maintaining mental health. Not all resources have to be treatment, such as therapy. Sometimes something as simple as learning how you organize information can help your wellness and mental health. So it's important to know that there are many kinds of resources out there. And 4, ensuring quality mental health treatment and resources. Mental health treatment at its outset was pretty inhumane. We've come a long way since that time, and we're still learning more and more all the time. As mental health professionals, we constantly renew our dedication to great and equitable services.
So we want to talk about some resources that are available to you to help you cope with any mental health issues or just significant stressors you might be experiencing. In the spirit of resources that support mental health, we want to remind you that you are a great resource for your own mental health, and so is your community. By taking the time to take care of yourself, honoring your needs, asking for help, taking breaks, engaging with your team at work, enjoying good company all around, and seeking space that's important for you. This may be related to hobbies or spiritual needs, anything that you feel supports your mental health, as well as that of the people in your community. A collection of resources is available from both DHR and the LA Health Services SharePoint, and we'll send the DHR resources page to be shared for all of you. We also wanted to highlight a few resources. So Wellbeing for LA is a partnership between DMH and UCLA that offers on-demand videos focusing on strategies to support and sustain your well-being. Kaiser offers a similar resource for Kaiser members at kp.org/self-care apps. By clicking on that link, it will send you and direct you to an updated link, but includes all of their resources for Kaiser members. For more formal care and higher level needs, the LA County offers assistance through EAP. That can be found at the DHR website. Services are provided by licensed psychologists, and it offers up to 4 sessions every 6 months. The first session can be done during work hours and is at no cost to you for all of those sessions. The DMH Access Center also helps to connect Medi-Cal beneficiaries to comprehensive services and clinics in your area that can be both remote and in person. As a county employee, you can also access the LAP, which is similar in many ways, but the services are actually provided by New York Life Behavioral Health. So both the Veterans Crisis Line and National Suicide Prevention Line can be reached by calling 1-800-273-8255. And the National Suicide Prevention Line can also be reached at 988. There's also a text that you can send to 988 for suicide discussions and prevention as well. The Veterans Crisis Line can also be reached by texting 838-255 or by going to www.veteranscrisisline.net.
We want to thank you for joining us today and hope you'll find something that works for you and your wellness.
Thank you.
Very important. Please reach out to those resources. We all need to manage our stress a little bit better, especially nowadays. And so that's very helpful information. So make sure you take advantage of that. It is also National Speech Language Hearing Month. So here at All of You UCLA, we recognize the vital role of our speech language pathologists and audiologists and the role they play in helping patients communicate, recover, and thrive. So thank you for the life-changing work that you do every day. Also Sunday, May 18th, which is this past Sunday, it's also Speech Pathologist Day. So shout out to our amazing speech language and pathologists here at All of You Medical Center. And thank you for all you do for helping our patients find their voice and thrive. And also, it is EMS week. I don't know if you saw that big banner that we have outside the ED. EMS week is celebrated last week, May 18th through the 24th. For all those folks working with EMS, thank you for being first on the scene. You're a vital part of our patient care team. Your commitment makes a lasting impact on the Silmar community and beyond. So thank you for all the work that you do. They're part of kind of our family too, right?
Absolutely.
They come into the ED and work with our ED team. And so we thank you for all that work. We also have recapping National Hospital Week. Did you enjoy the?
I thought it was fantastic. A huge shout out to all the folks who organize so many great events to recognize all of the hard work that you all do every single day of the week. So
did you try the cheeseburger or the?
I have a cheeseburger. It was delicious. So I'm not gonna lie. And they didn't run out.
They didn't run out. That was my goal. I told the guys I wanted to do a big shout out to Brenda, who's back here. Brenda and her team for really putting all this together. But yeah, starting off with the barista and in the conference center. You want to talk a little bit about the EDIA event that we had with the coffee?
Yeah, it was a really special event. Inviting all of our employees to come and really think about what, their history, their legacy, their family and traditions, and how those contribute to what they do every day within the hospital setting. And it's really celebrating our diversity and hopefully making everybody feel included. And then as a nice side benefit, everybody got a delicious handmade custom coffee drink
to order, blended and iced and hot. So
it was pretty high end. Again, shout out to Brenda and the entire EDIA team and everyone who helped out to make that such a special day.
Yeah, and I met a lot of you at the picnic that we had at Pickens Park too. We had a DJ, we had aguas frescas, we had goodie bags and cheeseburgers and hot dogs, and it was a cool event. And that night as well, Thursday night, we visited our night shift staff. We visited the different units, making sure that we provided them. A lot of them couldn't make the picnic in the morning, so we made sure that we provided some goodies for them during the night shift. So it was a nice hospital week, and we're going to do it better next year. We're just going to improve for the following year. We have this cool video that's coming on. Check it out. It's going to come out soon. The video recapping of all the events, and you might see yourself in that video as well. So stay tuned for that. But also want to let everyone know that we are on Instagram. So follow at @OliveView_UCLA. Stay updated on the latest news, events, and stories from the Olive View. If you have any stories, if you take any pictures on your beautiful hikes in the back, or if you have a walking club, I know Stella from our dietary department. She invited me to her walking club.
You got the invite?
Yeah, you didn't get the invite?
Yeah, I'm special hot in here.
But yeah, if you have anything you want to tag, let us know. All the great stories here at Olive View. Tag us on Olive View UCLA. Follow us there. We'll be providing a lot of information, shouting out recognizing some of our amazing employees, departments. So a lot of cool stuff there. So make sure to follow that as well.
I know. I was just going to thank you, our CEO, for really modernizing our public-facing sort of, all the different modalities, whether it's the View, whether it's Instagram, how we connect with people outside, in our community, outside of our community is critical for our hospital and for our reputation. And I think there's been a lot of really innovative changes. So thank you for.
Yeah, no, I just want to make sure that you guys are being recognized for all the great work that you all do. I want to make sure that everyone understands the amazing work that is being done here at Olive View every day. And so this is just one way to do that. So help us out and let us know all those great stories. All right, trivia of the week. Last week we had, or the last episode, we had a trivia question. And this is a trivia question. Which service offered here at Olive View helps connect low-income patients with social services, legal support, and housing assistance? The answer is the Medical Legal Community Partnership, Neighborhood Legal Services of Los Angeles County. And the winner, do you remember Martel?
Of course. How could I forget Martel? He was a participant in our amazing Hot Wing Challenge.
Yeah, he was second runner-up. I think he came in third place. So Martel Shaw, congratulations. You are the winner of my gift card. Come on over to administration. Let's talk about your experience after the ingesting all those atomic hot sauces and those wings. He's a telephone operations supervisor in the communications department. So congratulations, Martel, and thank you for participating and being brave enough. I tapped out at wing number 3 out of 6. I started feeling dizzy. I felt things in my stomach that I've never felt before. And I was like, yeah, if I go for number 4, they're going to pick me up off the floor. So, big shout out to Martel and also the other participants and Miguel Poblano, the winner of the, congratulations. I hope you're feeling better now. It's 3 weeks out. But congratulations, Martel. Come on over to administration and pick up your gift card. You want to help us out with the next trivia question for next?
Absolutely. So this is a good one. In the early 20th century, Sylmar was home to one of the largest olive groves in the world, operated by which company?
Good. All right. Everyone's Googling quickly right now. So first one to answer.
Now it's all about ChatGPT.
Oh, chat. Yeah, that's right. First one to answer and post it on our feedback button will win the gift card. All right. On to shout outs. As customary, new employees, welcome to all of you. Welcome to the family. If you see us around, say hello and let us know, hey, I'm new here. And just saying hello, introduce yourselves. Thank you for being part of the team and continue to provide that exceptional care. A couple of above and beyond shout outs. Adam Miranda, which is a senior clerk in office services. He was approached by an upset patient with a medication issue. He was just passing by, but Adam listened attentively, responded with empathy, helped the situation out with professionalism. And he's a great reminder of the power of simply listening and helping out. Adam, thank you so much for that. That exemplifies the spirit that we are looking for, that we are here at All of You. So thank you for doing that.
I'd like to give the next shout out to Myra Naba, who's a nurse in our urgent care. She's absolutely fantastic. I've had the privilege to know her for a while, and she's always taking initiative to ensure clinics run smoothly, that colleagues have a great workday, that her staff are, feeling included and participating in their work. And so she's a constant reminder of the amazing folks we have here. Thank you, Myra, for all that you do.
The next shout out comes from a patient's son, Nisen Samayoa, a phlebotomist from the ER. The patient's son said, very helpful in getting my father in for an emergency. They showed how they care, went above and beyond to ensure that everything was done correctly with efficiently. Congratulations. And a huge shout out to all of the phlebotomist department. We recently had to move them out into the auditorium. And all the team that went in to support that work because we had some issues in the phlebotomist area, and so we had to move the entire team out, and they're continuing to provide that care to our patients. So huge shout out to all the phlebotomists and the lab department as well.
Next, we have Norma Bransfield. She's an RN on 3D, and even though Norma, 3D was really busy at the time, she didn't hesitate to help. She stepped right in, took one of the nursing assignments, and sent that nurse to help in L&D. This person not only saw Norma taking on her assignment, but also helping other nurses. And she didn't complain. She just worked and helped out her sister unit. And that's the kind of all-in mentality that we really value here at All of You.
Yeah, lots of shout outs this week. Maria Imelda Sioko and Dennis Chamling, both are very accommodating in the urgent care. Thank you so much. Also, Nicholas Bon Burley, the DO from Clinic C. He's been always polite, concerned about his patient. It takes a lot of time to listen and answer any questions.
Finally, Kevin Hernandez Reyes, an RN on 4A Med Surge, always attentive to patient care, showing professionalism, dignity, and respect. Thank you for all that you do.
Keep up the great work. If you have any shout outs, please submit them through the feedback button. We want to go through a couple good catches, and these are good catches where folks, identify potential issues in the process, and they speak up and they say, hey, this is something that we need to fix, or something before it even reaches a patient or becomes a problem. So Nguyen, who we went in the blood bank, thank you for identifying a discrepancy and being able to clarify that right away. Also for Sun Vu, also from the blood bank, clarifying an order with a provider to ensure that the process was running smoothly. Thank you so much, Sun. And a pharmacist also as well.
Yeah, Jennifer Schiffbauer identified a prescription order that wasn't as clear during a patient consultation, and that really ensured the medication instructions matched the dosage, so that the patient knew exactly what to do with the medication.
And Deanna Davis, a pharmacy technician, also identified a billing error, which was able to help us out in the invoice and saving some hospital some substantial amount of money. So thank you so much for that, Deanna. And Evelyn Bermudez at the blood bank also identified clarified an order with a blood product. So she was able to clarify that with the provider.
And finally, Daniel Liu, one of our PEDS pharmacists. We have a lot of blood bank and pharmacy today. Really just, again, clarifying a NICU pain order for pain medication to make sure that it was the recommended dose and that the right dosage was administered. So thank you, Daniel.
Yeah, volunteer, which important team members was also recognized by a patient. This goes out to Brian Benya. Brian Benya did an excellent job transporting me to cardiology. He was very caring. Huge shout out to the entire volunteer department. Your work is invaluable.
Yeah.
You're usually quiet behind the scenes, but we understand the work that you do, and it does not go unnoticed.
Indeed. And another patient recognized Lorena Fonseca, our intermediate clerk with neurology. Lorena confirmed the patient for a neurophysiology test. The patient was so thankful for her professionalism and kindness, and gave a rating of 7.5 on the scale of 1 to 5.
Wow, exceeded it. All right. And so as we go every week, and you're part of the executive team rounding, and we visited the dialysis center. You want to talk to us about the dialysis center?
Yeah, it was fantastic. They've done so much great work. Just to make sure we're all in the same understanding. All of you offers a hemodialysis program for patients with acute kidney injury, chronic kidney disease, and for those needing regular dialysis. but they also rolled out a new program. Recently, we started our plasmapheresis program. And thank you to Kim Wright and all of the nursing leadership and everyone in the dialysis center and PIC area for learning an entirely new skill set to offer life-saving services, plasmapheresis, to our patients who are acutely ill and could unfortunately have bad outcomes. The team is made up of nephrologists, nurses, attendants, dialysis technicians. They provide the evidence-based, high-quality care. They always integrate hemodialysis into treatment plans for patients with chronic kidney disease or acute kidney injury, and they really address the inpatient needs of kidney health and their families and all the questions that they have in post-treatment care.
Yeah, huge shout out. The fact that we brought this in-house, that program used to be a contracted service, and now we're providing it even timelier, right, and more getting that care to the patient that needs it right away. So, huge shout out to that team. Thank you so much. I know they didn't want to take the picture, but we're posting their picture here now again. But huge shout out to that team. Thank you so much. All right. We're going to answer your questions. We've been receiving a lot of feedback and questions and suggestions in that feedback button that we address here. And we're accountable to, your questions. And we'll start off with the first question from Anonymous. How much did you pay for that amazing desk that you see here?
I thought this was at least several tens of thousands of dollars, right?
Not at all. It's actually, we don't want to reveal all the movie magic, but it's actually green screen, right? It's all an illusion.
No way.
Yeah. For example, which I'm going to ask the guys to put a different picture from behind you. Ready? 1, 2, 3. See that? All right, change it back. Ready? 1, 2, 3. All right, yeah. So we didn't pay much. It's really the people behind the scenes here, the IT team, which we should be shouting out as well. They're amazing at what they do. I asked them, can we create a professional set? And they were like, Edgar, we got it. And they were able to create what you see. So thanks to them with their amazing work. So yeah, we didn't pay much. It's just the brain power of our IT folks and their talents. So thank you so much. There's a question about, at all of you, the stat CBCs and imaging studies like ultrasounds sometimes take longer than expected. Could we please address this? And yeah, I think it's an issue that we do recognize, and I know you're part of that team with quality to try to make sure that the providers and clinicians get that information quickly.
Yeah, it is a very difficult problem, and we recognize this issue. The delays in stat orders really aren't acceptable, and we're working with everyone to try to improve turnaround times. If you have details on a specific location or instance when a stat took longer than you think it should have, please be specific and hit that feedback button so that we can investigate further. And obviously, we're always trying to improve our services. And one of the key issues is just reducing the overall number of stat orders. But to do that, we need, as we've said, sort of predictable times for routine orders as well. So we are working on that.
And this is something that the lab team reviews continuously, right? I mean, this is something that the metric that they continuously try to improve as well. And yeah, I mean, there could be delays and, sometimes the machine breaks down or there's issues with the machine that they need to fix. But we hear you, and it's something that lab is reviewing on a continuous basis. But thanks for the feedback. You want to do number 2?
Sure. Another anonymous piece of feedback: can our first and second floor guest restrooms please be attended to? As an employee, I use the guest restroom to make sure they're clean and have toilet paper. So we actually, first of all, I just want to thank you for providing this feedback. It's really important that we always are presenting our best foot forward to our patients. And it's a sanitation issue as well. We did inspect these areas. Overall, the women's restrooms on the first and second floors were found to be in good condition with minor maintenance issues identified in the first floor restroom. And we have submitted work orders as well to address all the concerns that were noted. So again, thank you for inspecting them and looking through the patient lens, and we will definitely attend to this moving forward.
Yeah, shout out to our EVS workers that they understand the assignment and the importance to make sure that, like you said, we have a clean and sanitary environment for not only our patients, but our staff as well. And so they were quick. We sent them over this information and they were quick to check it out. So thank you to the EVS staff. Safety in the emergency department. The doors from the waiting room to the ED do not lock, and anyone can walk in at any time. Can you please address? Absolutely. This came up from one of our executive rounds, and our facilities team and Frank from our safety and security team started looking into it. The door is fixed. So if you have any more questions about that door, please reach out to your manager, Juan, who is involved in the fix. So the lock fix works now. So that has been addressed. Now we've actually increased security in that space as well.
Since you are a foodie, another anonymous request, please have yogurt parfait or acai bowl stations in the morning. We have a very nice salad station that is not being used in the morning. We love our burritos and other breakfast fares, but sometimes we would like lighter options. I think this is a great suggestion. I think we should definitely discuss it with our staff and see what we can do. And, we look forward to providing updates moving forward.
Yeah. Sergio, our nutrition services director, I know you're watching. So, could we do that?
That's a good idea.
That's a good idea. All right. And last is in regards to nursing week, year after year, there's a lot of day shift. There's a lot of activities during the day shift. What about the evening and night shift? Are there going to be any activities? You're absolutely right. This is something that we discussed to ensure that next year we will have, and you're going to mark my words, you can go back to episode 10 and you say, Edgar, in episode 10, you said we were going to have an activity for the evening and night shift. We will do that next year. We understand that, our operations, our services are 24/7. And there's a lot of folks that work night shifts, that work evening shifts that can't be present for our day shift activities. So absolutely next year, we will plan an evening shift activity so that you all can be part of that as well. So this is coming from a former, long time ago, night shift employee. So we reached the end. How did it feel to be back?
It was great to be back.
Yeah.
It's always good to be here.
Yeah, I think you should be a permanent mainstay here as a co-anchor on our View. Thank you all for tuning in. Again, remember, follow us on YouTube, on our channel. Make sure that we have a lot of great information. Let your coworkers know. Also, follow us on Instagram, where you can get a lot of information. You can see your coworkers be shouted out. Your coworkers will be shouted out there. A lot of great information as well. And tag us if you have a story that that's related to all of you. Let us know. Please be safe, help each other, and be kind to each other and our patients. And we will see you soon.
Hi, I'm Edgar Solis. I am the CEO here at All of You Medical Center, and we're here today celebrating Hospital Week. As you can see behind me, we have all our staff, and they're enjoying food and desserts and special aguas that we're providing for them. And it's really just to recognize the work that they've done here for our community, for our patients. Extraordinary work, and we are so grateful for them being part of All of You, and this is why All of You is such a great facility. Thank you very much, and happy Hospital Week. Hi everyone, my name is Edgar Solis. I am the CEO. I just want to wish you all a happy hospital week. Thank you for everything that you do. This is a small token of our appreciation for everything that you do every day for our community. What you do, the work that you do matters to everyone. You make an impact in people's lives, and we truly appreciate that. I know I speak for the community and our patients when they say they appreciate the work that you do. So thank you very much. I also want to recognize some of the folks that are here. Atlas is here, and they're actually raffling off a weekend in Vegas. So if you guys visit that booth, and also the credit union, the All of You credit union is here. Please visit them, say hello to them, but enjoy the food. For all of you that hasn't seen or maybe seen the videos, I joined the hot wing competition. You guys hear about that? There was a hot wing competition, and I tapped out at number 3 out of 6, and I'm still paying for it on my stomach, but I'm doing okay so far. Thank you very much. Happy Hospital Week. Thank you for everything that you do, and I hope you enjoy. Thank you.